Hi, my name is Karrah Peterson. I'm a medical student here at UND. Today's lecture, we'll be talking about geriatric pharmacology and age-related changes. So why does this matter? In older adults, they are more affected by polypharmacy, and polypharmacy is the simultaneous use of greater than 5 drugs in one individual. There are higher associations with adverse drug events in this population. And what we'll be covering today is the key physiological changes as well as effects on pharmacokinetics and pharmacodynamics. For aging and physiological changes, in normal age-related changes, for body composition, there's increase in fat and decrease in muscle and total body water. For organ function, there's decreases in the renal, hepatic, and cardiac function. Receptor sensitivity, there's altered responsiveness in the central nervous system as well as cardiovascular system. This alters how drugs are absorbed, distributed, metabolized, as well as excreted. For pharmacokinetics, or more specifically, how the body interacts with the drug, we'll talk about absorption first. There's changes in gastric pH that can cause slower gastric emptying, decreased intestinal blood flow and motility, and this can cause delayed onset for some oral drugs and possible reduced absorption for pH-dependent medications. For distribution, there's increased body fat, which can cause increased volume and distribution for lipophilic drugs, decreased total body water, which increases the plasma concentration for hydrophilic drugs, and decreased albumin, increased free fraction of protein-bound drugs. This can all lead to greater risk for toxicity and prolonged drug effects. Moving on to metabolism, decreased liver mass and blood flow. This can cause decreased activity of phase 1 enzymes, such as the CYP450 system, slower metabolism that can lead to accumulation of toxicity risk, and preference for drugs with phase 2 metabolism. Moving on to excretion, there'll be decreased GFR and renal blood flow. In clinical practice, you should estimate the creatine clearance before dosing renally cleared drugs, such as digoxin and metformin. For moving on to pharmacodynamics, or changing to what the drug does in the body, for altered receptor sensitivity, there's increased sensitivity to CNS depressants, decreased sensitivity to beta agonists and baroreceptor reflexes, impaired homeostatic responses, and then the same dose at a younger age used in the older age can have greater unpredictable effects. So in summary, aging alters all phases of pharmacokinetics and pharmacodynamics, higher risk of adverse effects, toxicity, and drug interactions, ensuring patients understand how to take medication and are using the correct dosage. These are my references, and this is the end of the presentation. Thank you for everyone listening, and this is my contact information. Please feel free to reach out if you have any comments or questions.